Should we show her our
I did my paper on the story of statistics in medicine because that is my major. And throughout the paper, I learned a lot of how statistics has transformed medicine throughout history, and also how it continues today to allow doctors, nurses, scientists, and medical professionals of all kinds continue to make advances in healthcare. The great British statistician George E.P. Box once said, "Statistics is or should be about scientific investigation and how to do it better, but many statisticians believe it is a branch of mathematics." Now, I agree that the physicist, the chemist, the engineer, and the statistician can never know too much mathematics, but their goal should always be better physics, chemistry, engineering, and in the case of statistics, better scientific investigation. While statistics is a branch of mathematics, its importance transcends to many different fields of occupation. Today, its importance is especially known in the medical field as it allows for scientific investigation and clinical research studies. However, although implementing statistics in medicine today is very highly regarded and kind of an obvious thing to do, it wasn't always accepted. Some historians believe that the very first recorded clinical trial dates all the way back to Daniel of the Old Testament of the Bible, when Daniel and his 3 friends were sent to King Nebuchadnezzar's court and they were offered a rich diet of meat and wine. And Daniel and his friends didn't want to eat that diet and they wanted to stay on their kosher diet, but they also didn't want to offend the king. So Daniel proposed an experiment to test the kosher diet versus the king's rich diet. Then many years later in the 18th century, the first arguments for the use of statistics in medicine emerged and they were widely rejected. It caused great controversy as great minds like French physiologist Claude Bernard urged doctors to reject statistics. And he believed that for medicine to be truly scientific, it must be based on certainty, on absolute determinism, and not on probability. However, there were other people of that time who did believe statistics should be used, and they are Pierre-Simon Laplace, and that's him in the top corner, Frederick Gauss, and Francis B. Hawkins. They believed that probability and statistical theories could greatly improve procedures, research, and testing. And they said the complete opposite of Claude Bernard, that medical statistics actually affords the most convincing proofs of the efficacy of medicine. Another 18th century important figure in statistics was Belgian astronomer and mathematician Adolphe Quetelet, and he used statistics to solve problems of sociology, biology, and medicine in his work. Then, in the 19th and 20th century, the British Biometrical School, led by Sir Francis Galton and Carl Pearson, they displayed how statistics should be transformed from being an empirical social science to a mathematical applied science. Florence Nightingale, as you can see in this picture, she was actually a contemporary of Galton's and the first distinguished female statistician and the pioneer of nursing. She used statistics to completely transform the unsanitary conditions of the British military hospital in the Crimean War, and it dramatically decreased the death rates of the soldiers there. And she completely transformed how hospitals were set up using just statistics. And in 1958, statistics in medicine took another huge leap when the Johns Hopkins Medical Hospital introduced statistics into their medical school curriculum. Some historians believe that the development of statistics in the 20th century, or the 19th and 20th century, might have had an even bigger influence on the practice of medicine than antibiotics. So that's a pretty bold claim when you think of how important antibiotics have been for us, that statistics may have been even more important to medicine. For my 2 interviews, My first one, I interviewed Dr. Margarita Smith, and she's a dentist in Collierville, Tennessee. And she told me how doctors must be able to study and interpret the published results of other doctors, such as like their clinical research and new improvements in medicine and treatments, so that they can offer the best care possible for their patients. Specifically in dentistry, they often measure the outcome, success, or failure rates in various restorative dental materials used to create healthy teeth. And they also use statistics when looking at the populations of their patients, such as there being more decay in the old versus the young, and also rural areas versus urban areas. There would be more decay because the dental care facilities aren't as available. And I also wanted to see what statistics in nursing would be like. So I interviewed Paige Moore, who's an RN staff developer at North Mississippi Oxford Hospital. And because she works in nursing education, they often look at the development of policies and practices, new implementations they can use. And whenever they're trying to decide a new practice to put into their hospital, they have to examine studies that have already used it, and they look at the results of those studies for accuracy to see if it actually works. Nurses are also very responsible for analyzing statistical breakdowns within the population of their patients in their hospital, and they look for averages, outliers of infections, and delays in treatments. She also told me that her hospital just recently implemented a new product to prevent central line infections, and her department was responsible for making sure all the nurses were complying with the new procedures and had to make breakdowns of when the product was not used. And I also looked at 2 research articles to see what a doctor would look at, just to examine a new medicine or treatment. And so this one was done by Vanderbilt University Medical Center, and they were trying to find out whether it's an inhibition that you add to chemotherapy, and they wanted to see if it helps. So in their experiment, they had a double-blind and placebo-controlled to evaluate the effectiveness of this checkpoint inhibition called atezolizumab. Do any of y'all know how to say that?
You said it.
Atezolizumab. I'm gonna say atezo probably, but they added it. And they wanted to see if they added that to chemotherapy, if it would help patients with small cell lung cancer. And their subjects of the experiment were 403 patients with no previous treatment, with 201 being in the experimental group and 202 being in the placebo group. The trial was 4 21-day cycles of receiving chemotherapy with either the atezo or the placebo, followed by a maintenance phase. And after 13.9 months, the results were that the median overall survival rate was 12.3 months in the experimental group and 10.3 months in the control or placebo group. And then the median progression-free survival rate was 5.2 months in the experimental and 4.3 months in the control. So based upon the results, the researchers were able to conclude that the addition does help in treating small cell lung cancer. Then in the second one, I looked at hydroxyurea for children, and it's a known sickle cell anemia treatment in developed countries, but it was unknown whether it would still be effective in underdeveloped countries, because there are many factors that could go into if this treatment is still effective, such as malnutrition and malaria. Their subjects of the experiment were 635 children with sickle cell anemia, ages 1 to 10, and the trial, they gave each child 15 to 20 milligrams per body weight a day for 6 months, and then followed that by dose escalation. And the results were that hydroxyurea increased the hemoglobin and fetal hemoglobin levels, and it also decreased the malaria rate from 46.9 to 22.9 events per 100 patients. So this research was also successful and proved that hydroxyurea could be used even in underdeveloped countries. And then I filmed this video about a Stanford statistics class specifically for medical professionals. It's like a promo video.
You have to use the little speakers.
In that trial, about 8,000 people were randomized to receive an experimental HIV vaccine, and the same number were randomized to receive a placebo vaccine. At the end of the trial, 51 people in the vaccine group had contracted an HIV infection versus 74 in the placebo group. How do we interpret the results of this study? Given these numbers, do you think that the experimental vaccine actually had any effect? This is a hard question to answer. Clearly, if there had been 60 infections in the vaccine group versus 65 in the placebo group, we would all chalk this minor difference up to chance and conclude that the vaccine was worthless. Similarly, if there had been 5 infections in the vaccine group versus 120 in the placebo group, this would be a landmark moment in the history of medicine because it would be clear that the vaccine worked. But with an imbalance of 51 to 74, we can't simply rely on intuition to draw conclusions. This is where we need the tools of statistics. Let's make an analogy.
So that was just an example of what the class would look like exactly for medical professionals.
Imagine that the vaccine doesn't work at all. In other words,
There we go. So while statistics has greatly transformed medicine into what it is modern day, its story is not yet over because it will continue to advance and evolve along with every new medical breakthrough and advancement in healthcare that comes.